Okay, so welcome back, everyone. So my name is Atif Bhatti, and I'm a volunteer here for Epilepsy Foundation Northwest. So I wanted to introduce you to our next speaker. Our next speaker will be Rebecca Fraser, who will speak on the topic of transition to adult care. Rebecca works with patients and families through the epilepsy program here at Children's Hospital. She previously worked as a child and family welfare social worker with the DSHS Division of Children and Family Services. Rebecca also received her master's in social work from the University of Washington. Please welcome Rebecca Fraser.
Well, thank you for having me. So we're going to talk today about transitioning to adulthood. And between the ages of 13 and 18, or in some places like Seattle Children's on occasion 21, patients will transition from pediatric to adult healthcare providers. Transitioning to adulthood includes changes in healthcare decision-making, transition to independent health management, changes in access to support resources, and changes in healthcare providers. That's a lot of change happening all at once. And so sometimes there can be big feelings about transitioning. After many years at a coordinated pediatric facility, the transition to adulthood can be overwhelming and it can be scary. There are a lot of feelings and connections that people have with their providers that they've known for a long time. A lot of changes, like I said, are happening at once. You're potentially losing relationships with longtime providers who know you or your child very well, loss of familiar surroundings, and loss of information access and decision making as your child turns 18. So why do we do the transition? As our children age and our bodies grow and change, we need to be followed by providers who are more familiar with adult medicine and how changes in our bodies happen as, I don't know, I'm losing my train of thought and I apologize. But adult providers that know how to integrate epilepsy into other health challenges that can come up as we age. And so 18 to 21 is around the time that most youth will make that transition. Okay. So being prepared to make this transition will help you and your child feel more in control and equipped for this change. And today, we'll talk about some distinct populations. Young adults with a diagnosis of epilepsy may have varying degrees of cognitive and developmental limitations that impact their ability to participate in and make decisions about their own care. So today we're going to focus on talking about transition for adolescents with epilepsy who are typically developing and adolescents with epilepsy who have significant developmental delays. So there are things that will apply to some but not all groups, and some for both groups. So the first thing that I think comes to most people's minds when I am talking to families about transition is that big age 18 decision-making and changes in healthcare authority and decision-making. So at the age of 18, your teenager's consent is needed to discuss personal health information with family members at both pediatric or adult facilities. So even if you haven't transitioned to an adult medical provider, that age 18 decision-making authority is in place anywhere that you're being seen. At that point, your child is now responsible as the key person for making decisions about their care. And that independence, that autonomy is applied legally to all 18-year-olds, no matter what their current developmental disabilities or limitations are. And that can be surprising to a lot of families who are here. Their child turns 18 and suddenly they are not allowed to call in and talk to providers directly, and providers are asking or saying, I need to speak with the patient directly. So being prepared in advance that that's going to happen will be helpful. And just as an aside, for mental health and sexual health decision-making, that age of consent is 13. So teens who are able to consent may sign releases of information with your provider to allow medical providers to share information with patients and caregivers, or parents and caregivers. So that is not the same thing as decision-making authority. It's just information sharing. So that would be a teenager saying, I would really like my mom or dad to help me be able to call the nurse's line when I have questions, or to help me to gather information for me if there's lab work and I need to make a phone call and I don't really know what to ask. They can sign releases of information. That does not give you any legal authority, but it just allows us to share information with you. So legal authority. There are two ways that caregivers can legally continue to manage or assist with managing decision-making. Those are guardianship and power of attorney, and we'll talk about both of those. So guardianship is a formal legal process to give a person the power to make decisions for another person. It doesn't have to be a parent or a legal caregiver who was the caregiver at under 18. It can be any adult that you identify as being an appropriate guardian. It is a legal process that has to go through Superior Court. It has to be filed in court. There is typically the assignment of a guardian ad litem, who is an independent person who will meet you and your family and your child and evaluate whether or not they may truly meet a criteria for needing a guardianship. And the reason that we do it that way, and that it's done that way, is because guardianship is the most intrusive option, because it legally deprives an individual of their ability to make most decisions. And so because of that, guardianship is appropriate in instances where the person is incapable of making those decisions and potentially is at risk of being harmed if there is not someone who is able to make those decisions on their behalf. So it is more of a tedious process because it involves going through court. It can be done without an attorney if you have the savvy to try to figure out how to do it. But there are lots of attorneys who also can help walk you through this process. So the other option is a power of attorney. And a power of attorney is a document which gives a person, which a person gives to someone else to provide acting and legal authority for them. So that would be a 18 or above now young adult who has said, I think that I will probably need some ongoing decision-making assistance, and I want somebody to be able to help make decisions for me, especially if I have become incapacitated and can't make my own decisions. It can give a parent or whomever they identify as their power of attorney, powers over healthcare, finances, or both. And that can allow you to create joint bank accounts, be your child's representative payee for SSI, and communicate with DDA, as well as make medical decisions or assist them in making medical decisions. It requires no formal court process, but should be filled out. There are forms to fill out that should be notarized, and most of those forms you can get assistance through an attorney to do. It's not required, and some of those forms are available in various locations online, which we can talk about at the end. A power of attorney can be rescinded at any time by the young adult or the adult. So if they decide at some point that they don't want the assistance anymore, or they don't want somebody making decisions on their behalf, they can rescind that. But it does give them the right to be involved in their decision making. So if someone has power of attorney over their child, their adult child, and the child and power of attorney are not in agreement with a treatment course, typically the person with the actual individual would have their final decision and about what to do. So this is really complicated, and sometimes families have a hard time deciding whether or not guardianship or power of attorney is going to be the right course, or just how to do it. So consulting an attorney to discuss your family's specific needs is the right path to discuss and determine the right plan. So now we're gonna switch over to talking about helping guide your teen toward healthcare independence. And this, I did not create this model, and in fact hadn't actually seen this particular model until just recently. I have a child who just started kindergarten, and I got this model from her teacher. But I think what the most important piece that I like about this model is just the line across the bottom. Starting at around age 13, when we're starting to plan for transition, is a good time to start this model with I do, you watch. So your child is with you in appointments or hearing you on the phone, talking to providers or calling the nurse line, coming with you to the pharmacy to see how you pick up medications. And they're just watching and being part of their care. And then as they get a little bit older, we move to level 2, I do, you help. So maybe there are pieces of the phone call that your now teenager can be participating in, or you can go to the pharmacy and let them help with parts of picking up their prescription. Then you do, I help. So now your child is actually doing some of that work, like going up to the pharmacy counter, talking to the pharmacist, picking up the prescription, and you're still there. You're making sure that it's going well. You're making sure there's no mistakes. You're guiding your teen. And then as we get close to 18, I do, you watch. So, or you do, I watch, I'm sorry. So your teen is doing and being responsible for their care. They are doing everything. You are just watching and making sure that it's happening safely. And of course, you can always speak up. But that is sort of the trajectory that I think is really important to start thinking about, especially when your child enters their teens. So when I saw this model, that really spoke to me. That's why I wanted to include it here. So adolescents should know as they're moving toward independence, some of the things that you want to be thinking about when we're talking about the gradual release of responsibility, the I do, you watch process. When your teen turns 18, they are going to need to be able to be in charge of their own medical information. So they are going to need to know what medications are prescribed for them, how and when to take them. They're going to need to be able to explain their medical needs to others and know what to do in an emergency. And they're going to need to know how to contact their own primary care provider and any specialists. And I think if I can make this work, I have a link here. We can't open it. Okay. Well, on the table, the Seattle Children's table outside, what this is was actually printed out. And it is a transition readiness assessment that is produced by gottransition.com. And it's a nice assessment. I was just going to show it to you, but we weren't going to go through the whole thing. But it's a nice assessment that asks questions about what your child should be ready to know as they are transitioning, so that as you're going through this gradual release of responsibility chart, you are also keeping in mind what types of things are specific to your child that you would like them to know. And that's available out on the table if anybody wants it. It's also available online, and I'll have links at the end here. Okay, so services and supports in adulthood start to change as well. If you are or your child is utilizing supports like DDA, SSI, if their insurance is covered by Medicaid, those things start to change as children turn 18. This, again, I did not create this. It's very pretty, but it is from the DDA website. This is just their little roadmap, talking about things that you need to do when you're thinking about services starting around age 14. And I'll, on the next slide, have a little bit more detail about this. So at age 16 to 17, if your child has an IEP, you should be making sure that that their teachers are including transition services in their IEP. And that is for any child with an IEP, no matter whether their trajectory is going to be college or vocational activities. The school should be doing some specific work to make sure that that's part of their transition plan by the time they turn 16, and that should be included in your IEP meeting. And part of that is pre-employment transition services through DVR. That's the Division of Vocational Rehabilitation, and they work with young adults and older adults to access vocational skills and be placed into different vocational activities. And they start working with your teen during their high school years when they turn 16. The other thing to consider if you don't already, if your child is not already enrolled in DDA, is to consider enrolling in DDA. That is the Division of, or they changed it, the Developmental Disabilities Administration. And that program, if your child is eligible, at some point would potentially be able to provide financial support or caregiving support for various things that your child might need. And not every child needs to use those services, but if you aren't enrolled, it's a good time to enroll. And just being enrolled does not mean that you are accessing anything. It just means that you've kind of told them that you're around and they've said, yes, you're eligible. And if, as your child ages and becomes an adult, they identify that there's a specific, maybe there's a assistive device that they would like to be able to acquire that costs money that insurance won't cover, and they can ask DDA, because they're enrolled, to please assist with that if they have funds available. DDA is a through DSHS program. So many children already are enrolled. If you are, then you can ignore that 16 to 17 piece. At age 18 is a good time if your child is not already enrolled, or if they are receiving SSI, because at age 18, SSI does not count income from parents. So many children who did not qualify for SSI because of eligibility requirements, financial eligibility requirements, may qualify after they turn 18 because their parents' income won't be counted anymore. And that increases the likelihood that they'll be eligible and may be able to receive some financial support based on their epilepsy diagnosis. At age 19, if your child needs to transition from child Medicaid, that ends at age 19. If your child was on Medicaid covered on Apple Health, that goes through their 18th year till age 19. And if they are not covered on your own insurance or the parent's insurance, then they would need to apply for adult Medicaid. That is also the time for a formal application to DVR if your child wants to, or if you or your child want them to continue doing some more formal vocational work. And then at age 20 is when the next time that DDA eligibility is reviewed for those, for everyone, but for children who had it before they turned 18, from age 10 to age 20, there are no reviews required until age 20. That's kind of a lot. So the last piece is the actual transition to adult medical care. And so that can be a piece that that could be the scariest piece, because that's the official, I'm leaving my pediatric provider. So there's a couple ways to start doing that. And the first would be to identify an adult provider. Talk to your pediatric neurologist, talk to any other specialty providers that your child might see, and talk to your child's PCP for recommendations. At Seattle Children's, we see patients from Washington, Idaho, Montana, and Alaska. That's a huge range. And so while all of our neurologists are really familiar with other adult neurologists throughout that region, you also may have other information from local providers as well. So you want to talk to everybody and see what is going to be the best fit for your family, and what is your insurance going to cover for you to go to. Once you have identified your adult provider, you need to actually transfer information to the provider. So the best way to do that is to contact, here it would be to contact the neurology RNs, let them know this is the adult provider that we've identified, and we would like all of our child's records to be transferred there. And if your child is already 18, then that they are the person that would make that call, or should be making that call and saying, please send my records to this place. Then the next step would be to schedule a last appointment with your pediatric provider and a first appointment with your adult provider. Having them both those appointments scheduled up front helps to make that transition. Sometimes people say, okay, this is going to be my last appointment with my pediatric provider, but they didn't actually get scheduled with their adult provider, and then some time goes by and they're like, oh, I really need to go back and see my provider again. It's time for another appointment, but I haven't got in with my adult provider, so I'm back again. to the pediatric provider. So scheduling them both kind of at the same time is a great way to make sure that that transition happens as on schedule and timely. And it also will allow for good current communication between your pediatric provider and your adult provider so that they can talk to each other potentially or see the most recent notes from the last appointment as they're getting to know your now adult child. There is a program that supports patients with complex medical needs, the UW Transition Care Program. Enrollment in that program, and it's based out of University of Washington Medical Center, enrollment in that program requires patients to be age 18 to 24. It requires that they're seen by 3 or more specialty services, and it requires a referral from your medical provider. That could be your PCP or one of your specialists. And when you are part of that program at the UW, they are working as a program care team that includes doctors, nurse care coordinators, and social workers to actually walk you through all of this that we just talked about. But it's a very specific population that they are working with and addressing. Oh man. So I don't know that these links are going to work. I was going to pull them up and show you. Let's see. Several of these are websites. I'll see if they work. We'll just look. Nope. Okay. So that one on the bottom is the same one that I was showing you earlier, and that's out on the table. And then gottransition.org is a really excellent website. It is very dense. When you open it, you're going to see tiny font and a lot of words, but taking some time to go through that website is going to help guide you with some questions. They have frequently asked questions. They have tips for talking to your providers. They have a lot of these checklists, like the one that's going to be out on the table out there, that can walk you through more specifically what you feel pertains to you and your family. And there's also links to different research projects around transition and care. This K12.wa, the second link there, that is actually a link to one of the educational office of the superintendent for Washington State that just talks about transition and that what I was mentioning earlier about your IEP and what things to expect. And there's a little bit more detail than what I just mentioned. But it talks about what to do if you feel like your school is not following through with getting transition planning going for your child, and how to ask for those things. It's not on here, but wapave.org is another really good website that has links to parent advocates to help you if you are struggling with your school with an IEP or a 504 plan and feel like you need some additional assistance walking through communicating with the school to make sure your child's getting what they need. The top link here is a Seattle Children's website that really encompasses a whole lot of information about transition. A lot of what I talked about here can be read in more detail, and there are specific headings that you can click on what you feel like pertains to you. And then WashingtonLawHelp.org is a place that is really a great conglomeration of legal resources. Specifically, they have resources regarding questions and answers about guardianship, including power of attorney documents that you can actually print out. And if that is what you want to utilize for your power of attorney, you can use those and get them notarized. Or it can give you an idea of what you would actually be signing if you were to go to an attorney and have somebody draw that up for you. There's lots of really good information on that website, but specifically there's the guardianship information. So if you have any questions, I'm happy to try to answer them for you. So I didn't put it on here, but it's WAPAVE, PAVE.org. And I believe that once you get onto that website, you scroll for a tab that is called Parent-Child, or Parent. It is a name that is not specific to school assistance, which makes it really silly, even though that's what the program is. I think it's Parent Something Training. And that will give you some links to advocates in your area. They actually divide it up by region in Washington State. And you can call and talk to other parents who are volunteers, who have lots of experience doing working with IEPs and 504 plans. There have been times where families have actually had an advocate come with them to an IEP meeting from that organization, and that depends on the region and whether or not there's a lot of criteria that go along with that they would help you figure out. The other is this K-12 WA, the second link here. That's specifically a link to transition planning and talking about 504 plans and IEPs.
Are your services personally offered as a regular routine thing as our kiddos enter, into the adulthood, or should we request that? Or?
Right now, the best thing to do would probably be to request it. If you are scheduling an appointment here, you can ask the scheduler to please add social work onto your appointment, and you can let them know the reason so that we're prepared. I have a colleague as well, so there's two of us in neurology right now. I think it would be ideal if we could have it be an organized, formal kind of addition to all of your child's care here. But right now, best case scenario would be to ask when you come in if you have forgotten to ask in advance. Yeah.
So I know of a neurologist up north that she's a pediatric neurologist, but said she sees patients up to like age, I want to say 25, or something maybe even older. Is that unheard of, or is that something that's you hear?
That's not something that I'm particularly familiar with. At Seattle Children's, 21 is sort of our max age, except for very specific circumstances that are determined between your provider and the hospital regarding what needs your child has. But I think that as long as the provider feels comfortable continuing to provide that level of care as children become adults, I think that that's okay. But it's something to be aware of, and just know other health issues and health needs come up as we age, and so finding an adult provider that knows how to integrate that is important.